Good evening. I decided to choose for my presentation disease was Hutchinson-Gilford Progeria syndrome. This photo that I had chosen will be what we'll be discussing throughout the slides: causes, diagnosis, signs and symptoms, treatment, and background. Moving on, the description of the mutation. Otherwise, HGPS is a rare genetic disorder that accelerates the aging process in children with this disease. It occurs in babies when they are born with it, and it lasts until the affected individual passes away, unfortunately. The bases in this disease are C, G, T, and A in the LMNA gene. LMNA gene is responsible for making proteins called lamins. Specifically, lamin A. Lamin A is defective and called Progeria, which causes nuclear abnormalities. If we take a look at the picture to the right, we have a healthy cell, and to the farthest right, it's the HGPS cell that is unhealthy. Discussion of transmission. Transmission of this disease occur through inheritance, but it is mainly acquired through spontaneous mutation of the LMNA gene. The occurrence happens in defective DNA. The random mutation is unstable and causes damage to DNA. Individual cannot transmit it to others like an airborne disease and through germs. So only way that is possible for it to be for an individual to unfortunately have it is through birth. So we'll take a look at to the right. We'll see the nuclear defects, elevated DNA damage, epigenetic alterations, loss of protein, homeostasis, chromatin disorganization, and then we can take to the bottom, take a look, cell and tissue defects, and also symptoms: growth impairment, cardiovascular disease, skeletal dysplasia, lipodystrophy. These are some of the symptoms that one may have. Moving on to symptoms, HGPS is not only psychological but also physical. Disease causes rapid aging. On average, one's life can shorten of an individual from teenage years to early 20s. Facial features, alopecia, eyes that are more prominent and a larger head, and pointed nose. Other symptoms are baldness, wrinkled skin, small jaw. I've noticed potentially sharp teeth. Although a baby can have this disease in their DNA while in utero, experiencing this disease can start months after a baby is born. So testing is very needed because it can show babies can fail to thrive and start to show phenotype signs of this disease occurring, which leads to the probable assumption of testing of HGPS. Epidemiology. 1 in 4 to 8 million births that occur makes this disease very rare and extremely spontaneous mutation to occur in babies. There is no specificity to a race or gender when it comes to this disease. HGPS may have a higher chance of producing in other children with the same disease, but it is not necessarily a guarantee. Not only is there no commonness in the children who have the disease, but also nothing related between the parents who proceed to have these children. So it's still a mystery. So moving on to screening, healthcare providers perform physical examinations on babies when they are born, very much needed. Physical exams done by collecting blood for genetic testing. Blood testing is used to focus on the LMNA gene and to further understand the DNA is defective. Diagnosing this disease is critical to the child's life to help treat the disease. Moving on. Treatment. So unfortunately, there is no cure for HGPS currently, but there is a treatment available to help reduce the replication Progeria in the body. FDA-approved drug called lunafarnib. Treatment has shown to improve cell function and delay the HGPS cells. This can include things such as infection. So with taking medication, this can include things such as infection, diarrhea, vomiting, and can help to decrease the symptoms that occur when an individual has HGPS that are causing premature aging. Also, studies and tests have also been done on control groups of mice that further help researchers to develop other options to treat Hutchinson-Gilford-Progeria syndrome. So that is my presentation on Hutchinson-Gilford-Progeria syndrome. And here are my references page. And that is all. Thank you.